Boys and girls, ladies and gentlemen, thank you very much for listening in to another one of our YouTube videos for COVID updates. This is the second one. Jason Leach obviously was last week, went down very well, but this week we have education expert Maureen McKenna, who is the Executive Director of Glasgow City Council Schools. Maureen, how are you?
I'm very well, thank you very much. Thank you very much for inviting me on, Andy.
Very welcome, very welcome. Could you tell the children just a wee bit about yourself?
Okay, my name's Maureen McKenna. I have responsibility for all the schools and the nurseries all across Glasgow, which means that we look after about 80,000 children. And we also look after the hospital education service in Glasgow. I'm a teacher, I'm a maths teacher. I used to work in secondary schools and I really miss being in the classroom.
Hey, right, we're going to just breeze right into these questions. Again, we'll just go over these and you can explain that obviously things are changing very rapidly. As you know, it must be an absolute nightmare for you and your staff to try and arrange this.
Today? I don't know.
It was just basically with them, there's various experts coming out and saying about the 2 metre rule and it's possibly going to change to a metre and the mental health and things like that. And it does seem as if it's going to go UK, well, England-wise just shortly. And going with the tradition, we're usually a couple of weeks behind that. But it must be very difficult setting these things up just now, knowing that it could all change by the time you go back to school.
It's a very, very fast-moving situation. And if you think back to when all this started 14 weeks ago to where we are now and how much we know about this virus, we're in a completely different position, aren't we? We've got lots more information, and particularly we've got lots more information about children and children's susceptibility to this virus.
And you've got another 6-7 weeks to after the holidays. It's amazing what can happen in 6-7 weeks again. It's absolutely.
And I think it will all change again. Yep. I think it will all change by the time we get to August.
Yeah. So as it stands just now, the plans for children's social distancing will be 2 metres when they go back to school. That's what it's set up as. Now, speaking to Jason Leach last week, he thinks that under 7s, etc., they'll struggle to social distance these children. Do you think they'll be allowed to just kind of go about their own thing in their wee bubbles, or will they be stringent at social distancing? I'd just love to know how you do that.
Not for me to contradict Jason Leach, and he has much, much more information on the science than I do. But I think Jason would agree too. You can't just put a boundary on 7. 7 and above's okay, 7 and below is not. Yeah. We know that developmentally, it's not appropriate for small children not to be close to each other. We are humans, we're social creatures, and we naturally go together. And for little ones, if they need to come and sit on an adult's knee, they should be allowed to come and sit on an adult's knee. If they need to come up close, their emotional well-being for me is much, much more important. And we also know now from lots of the evidence that children are not particularly susceptible to this virus. They seem to be very resistant to it. There have been, very, very few cases of children becoming ill, and children in Scotland, there's been no children have passed away under the age of 15. Mm-hmm. So, we do have to use that science to say, is it appropriate? And actually, should the importance not be on the well-being of our children and their mental well-being, their emotional well-being, just as much as their physical well-being?
Definitely, I agree totally. Yeah, actually, the figure for that was there's actually been no under 16s in Scotland tested positive whatsoever. And
that's amazing, isn't it? What an amazing statistic.
Well, it was actually their office. It was Jason Leach's office. I messaged for that specific 4-hour call, and I thought it was actually fantastic, absolutely fantastic. And I think the next age group, there's been maybe 4 or 6 between. I think the next group is from 18 to 25. There's been 4 or 6 or something like that in Scotland. So even that is for the older kids, it's pretty positive, But what he says is we have to be careful that they're not asymptomatic, and it can cause problems to the teachers, etc. What are your teachers going to be? Are they going to be encouraged to wear stuff, or is it going to be up to themselves for PPE to protect themselves?
Well, funnily enough, I'm just back from speaking to a group of young people out in a secondary school, and we were talking about face coverings. Mm-hmm. And we were talking about what did they think? Did they think it was appropriate for them to wear face coverings in schools? What about teachers wearing face coverings? But a huge part of teaching is your facial expressions.
Yeah.
That's really important, and particularly for small children, they read what you're doing by your facial expression. They might not fully understand the words, but they'll see from whether you're a happy face or a sad face, and that's the kind of social cues that people will take. So I don't think it's appropriate for teachers to wear face coverings. I don't think it's appropriate for children and young people to wear face coverings. And when you have the statistics that show that young people are not testing positive at all, and also, although they might be asymptomatic and carriers, actually there's not evidence coming through that they are transmitting. So young people are not transmitting that disease. And actually, there's a study in Australia that shows that their transmission risk is very, very low. So I do think we have to be very careful, and we have to think about what makes good learning and teaching, and not have I don't want a teacher dressed as Darth Vader at the front of a class. I want them to be engaging, smiling, that children can see them smiling. Children know school's a happy place to be in. That's way, way more important. And if when we've got the science to back it up, that the children are safe, then that's a much better place for us to be in.
Fantastic. And how would that go with some of the teachers or shielding and things like that? Would they be possibly? Well,
the current advice is that if teachers are shielding, then they need to stay at home. And perhaps those teachers staying at home could do online support. Right. Perhaps they could do, because we'll have children at home shielding.
Yeah.
So perhaps we could use technology better to teach those children at home who are shielding, or perhaps the children who are caring for adults who are shielding too. I think there's still a lot of things that we need to work with families on to make sure that we all stay safe. But I think there's opportunities for teachers to deliver in different ways.
But that's obviously an ongoing thing, and it's going to change again in the next 5-6 weeks. That may have to be looked at.
Oh my goodness. Without a doubt, it will change.
Right. So far, what's the plans for the primary school and the secondary school day-wise? We're hearing 2 and 2 with Wednesday off, and then we're hearing some it's 3 and then 2 and then 3 and 2, or 2 and 3 the following week.
So what we've asked our primary schools to have a minimum of 11 hours teaching.
Okay.
And what we've suggested is, you see, in a teacher's contract, they get 2.5 hours a week for preparation and class contact. And normally what that means for a child is that they will get 2 different teachers. They'll have one teacher who teaches them for most of the time. And then for that little 2.5 hours, they get another teacher coming in. But what we wanted to do was to maximize the number of teaching groups. So we took all that non-class contact time and we gathered it on a Wednesday. And that allows us to maximize the use of the teachers. So hence the 2 days in the primary, which will be slightly longer than the normal primary school day. So it might be until 3:30 or 20 to 4 instead of finishing at 3 o'clock. So a little bit longer days, 2 full days of teaching in a small teaching group in a primary school. But some of our primary schools came back and they said, well, I've got a group of children, like my nurture class, who 2 mornings and then 3 at home wouldn't really suit them. Could I do 5 mornings with them? And we said, of course. You have to take the available staff that you've got, think about your children and match to what meets them the best. So we'll have small targeted groups, perhaps getting 5 mornings a week or maybe 3 days. But we don't have enough teachers to be able to do that for absolutely everybody. So the vast majority will get 2 longer days. So
that'll be on a school-by-school basis, basically, if they go for depending on the resources, etc., and the needs of the children, then so it will change.
Right. Yep, absolutely. And each school will be talking to their parents and telling them what the arrangements are in their school.
I think this is the common, it's not a problem because obviously people we don't know yet. This is the common thing that parents are worried about because obviously they're having to juggle childcare, working from home, etc., etc. So if we kind of tell them this kind of stuff, it's good stuff because it's great information. I have teachers in the family and this is kind of news to me, some of the stuff that's coming out. It's fantastic as it's starting to dribble down from people like yourself. It's really good. Now, obviously the big rumour at the start was Wednesday was going to be a huge big clean because this bug was going to be everywhere, and the whole Wednesday we're going to deep clean the school, and there's going to be spacemen walking about spraying stuff and things like that. Can you categorically say it's not a massive deep clean on Wednesday, it's just going to be standard clean?
It's not a massive deep clean. The reason we've gone for the Wednesday is to pull together all that non-class contact time for teachers to allow us to maximise and make as many small teaching groups as possible in the other part of the week. It will also allow us to have cleaning teams do a thorough clean of the school. And that we'll be able to take teams, and they'll maybe be able to do 5 or 6 schools in the same day, because we've got cleaners who have to stay at home and shield. So we have to plan that too. But we do want a thorough clean between the two groups.
And how will that entail then when you finish on the Friday? How will it entail a thorough clean for the Monday, Tuesday kids coming in?
So they'll do a thorough clean on Friday night. And if necessary, they would move into Saturday morning. But our cleaners, our cleaning company think that they would be able to do that on the Friday night.
Right.
They're doing extra recruitment.
Right. Are your cleaners external in Glasgow then, are they?
They're not part of education.
Right, okay.
So they are part of the council, but they're not part of education.
Now what about, will there be additional cleaning during the day for like surface contact cleaning now, for kids touching stuff and all that kind of stuff?
Well, I think we also have to remember that children are not, they're coming into school healthy, so they're not carrying that. So we don't have to clean everything after a child has touched it. And we just have to have sensible, lots of hand hygiene, washing during the day, being sensible, but we don't have to clean. So I think what we would do, I think, we just have to manage that carefully. The children are not carrying this virus. We're going to ask children, if their children aren't well, stay at home.
Yeah.
So it's minimal amount of cleaning, but we will have additional cleaning during the day in all our schools. The
problem's coming, Maureen, is the media. The media's, I don't know if it's through unions or whatever, but the media tends to be making this very negative, and that's with parents and children. And I know a girl in South Lanarkshire, a kid 14, she's terrified to go back until there's a vaccine, things like that. So we're just trying to obviously reassure them that, listen, everything's up.
I couldn't agree with you more, Andy. I mean, I went through a phase during the lockdown where I stopped watching the news.
Yeah, same. Yeah.
I stopped watching it because it was so awful. Yeah. Everything, and it would have scared the life out of you. So I totally understand, and I think we will have some families who don't want to send their child back to school. Yeah. I think a very small number of families will be so anxious that they don't want their child. And that can't become a discipline issue for us. We need to work with our families and build that trust and confidence so that they can start coming back to school, because education is just so important for them.
Yeah, I think it'll be a slow start back in August for you. I think you maybe find they'll trickle in, as the weeks pass and things are okay, you'll maybe get more and more in. Anything, I think.
No, that way. The general view is that children want to come back. The children I've been speaking to, they are desperate to come back to school.
That's good. That's good saying. Right, as in when the children are back in school, any child that feels unwell, I remember the couple of days before it, again, we've been teachers in the family, when every 5th and 6th year and 4th year child was coughing so as they get sent home in the week leading up to the lockdown. They were all doing that. Will there be kind of temperature testing for any kids that feel unwell, etc.?
Well, temperature is only one indicator of COVID. And having a high temperature can be an indication of lots of things, not necessarily COVID. But if a child doesn't feel well, then just as we would normally do, they would come down to the office. What we've asked our schools to do is to identify an area where children would go if they don't feel well. It should be a well-ventilated area, and the children should be appropriately supervised. The adult should stay 2 meters away from the child, and if necessary, if the child needs any support and help, then we're providing a small, some face coverings, gloves, and an apron in order that children should be able to get that support. But we would be asking then parents to come and collect their child, just as we would do normally, just with a few extra precautions in there. And I think at the beginning, we will be much more cautious. You know, you'll remember the days when your mother stuck you out to school, come hell or high water. You know, even if you were saying, I don't feel well, Mum, you were out that door. And, you know, we need to have families to be sensible about it. But we also recognise the strain that families are under, trying to hold down jobs, trying to keep things on the road. These are hard times for everybody.
It's a huge balancing act, isn't it? A huge balancing act.
Without a doubt.
Right, we're key workers. Their children, the non-school attendance day, is the kind of hub system going to be in operation again for them if there's 2 key workers and their downtime?
So there is great discussion on that just now, because key workers have been in a very privileged position where they've been provided with free childcare. And I think that was really important that we did that through that lockdown, through that emergency period, really important. However, as we're beginning to ease out of it, and we are continuing to provide childcare for key workers during the summer break as well, but we've had to be much firmer about applying those criteria. During the lockdown period, we looked after about 750 children, of which about 500 were the children of key workers. The applications for during the summer, that number has gone up to 1,500. We have declined a large number of that, but we are still taking almost 1,000 key worker children who need childcare. When we get to August, there will be more and more people going back to work. How do we manage that and draw that line and provide it free? There has been no additional budget for this childcare. It has to come out of our core education. But I do think that we need to do something, because if the children are primary age and they're in school for 2 days, we need to do something for the other 3 days. But we have 42,500 children in the city that are primary age. 21,000 of them will be in school on Monday, Tuesday, and 21,000 in Thursday, Friday. What do I do with the other 21,000? Because the schools are full.
Yeah.
So I don't have a space in the school. You know, we've half the number going in to keep it safe. So I would need to find other buildings for the children to go to. They would have to be risk assessed, safety, put the right furniture in for children, say if it's a sports centre, so that they can do a little bit of studying as well as play. I need to employ people to look after them. So maybe potentially out of school providers. How many could we look after? Because you want people who are qualified to look after the children, not just anybody off the street to look after them. It's a mammoth task. So I do think as the summer progresses, we're having to have discussions with government about how we manage that, because the more I've looked at it in detail, the more I think, oh my goodness, I either look after a small number and I disappoint masses of others. How on earth are we going to do this? Because what is a key worker? A doctor, a nurse, that's very straightforward. But dentists are going back now. Are they key workers? What about somebody who works in Asda? Are they a key worker? Well, I like to go to Asda and have my supermarket shelves stacked. Should they be any different from a doctor? It is really hard thinking.
Well, that's what you're the executive director for, I'm afraid. To look at that, it's not an easy. You also need parents to play the game. You know, if there's 2 of them key workers and they're doing shifts, then they've got to help you. They've got to. If everybody uses their selfishness just to, you know, everybody's got to play a part in this.
But it's ever so hard for parents too.
Yeah.
So if they're trying to hold their jobs down, pay their mortgage, you know, life's hard with small children when you're just making enough every month, and then and you don't have an employer that says, you know, you can't work from home.
No, definitely. And also, you'll have the same issue a lot of your staff as well. We talked about.
Well, they are category 1 key workers, so we would. So not only would I have my doctors and my nurses and all this, but you have all the teachers' children. They need to be in.
But
Child development officers.
how does that stream down then? Does that stream down into your kitchen staff, your cleaning staff? Because they basically need to provide the food for the kids, and they need to be able to clean the place to make sure it's safe. So they the priority 1 for childcare as well in the off days too.
They must be, mustn't they?
Okay, fair point. Yeah, fair. So you've just good luck with that one. Again, we went through the non-attendance days, and that was one of the questions I was going to ask. Will it have to be off-site? Will it be sports centres, community centres? You've answered that one, but as you say, there's more to it. There's making it safe for the children and having the right people in place to look after them. What are the plans for the school meals, etc., and how will they be served? Because obviously, I think a lot of the secondary schools are now, the teachers are moving, not the children, to try and cut down the movement. Will that be the same with school meals? Will they be delivered to point of source where they're going to be taken in classrooms, etc.?
Well, it's a dining experience as part of your education, isn't it? So we've suggested to the primary schools that they stagger the lunches so that you have different groups coming down at different times so that they're able to sit appropriately spaced out. We have an entitlement to free school meals, but we also have children, that might be their best meal of the day. So it's important that we give them access to that and that it doesn't become here's a packed lunch, here's a curly cheese sandwich, you'll be fine with that. We do need to think carefully about that dining experience. But the primary schools are great at it, and they have looked at different times for lunch times staggered across the day. So lunch may take 2 to 3 hours, across the day, and we're just having to pay our catering staff that extra money to enable us to do that safely and to manage it appropriately. But I know that our catering staff are feeling a little bit challenged about it too, and we'll be having discussions with them through the summer.
And I think are some of your canteen areas being used for actual teaching as well because of the number thing? I know certainly in South Lanark.
Well, we're trying to minimise that. The gym areas, so the areas where the lunches are served sometimes double for gym, lunchtime, assemblies. So, they're a bit of a multi-purpose area. So some of them will be using part of that as a teaching area. But then we're also encouraging children to learn outdoors. So we're saying make use of your surroundings. Outdoor learning is a huge part of primary and nursery. So it's not just about sitting in a classroom. We should be outside because, again, we know that the virus doesn't do well outside, that actually being outdoors is a great thing. So I'm hoping that more outdoor learning will be built in as well. So
the children will possibly be getting the food at their kind of desks then, do you think?
It wouldn't be my choice for food at desks. It might be in some schools for some classes, but remember, you've got to then wipe down the desk. I mean, even the tidiest adult leaves a mess after they've been eating. A small child doing that, and you're guaranteeing. So is it right that they should sit and eat there and then have to do their work on it too? So again, I trust our schools. They know their children, they know their buildings, and they will do the right thing for our children.
And looking at that with the older children that you tend to seek out and they hit the kebab shops and curry shops at lunchtime and things like that, will they be kept in? Because obviously they're then bringing stuff from here, there and everywhere, and there could be contamination, or will they be?
Well, they're not allowed to bring food in from outside into the school in normal times. They tend to go to the ice cream van or as you say, the shop down the street. Shettleston Road, very popular for any kind of fast food that you fancy, and they'll eat it in the street. A lot of the secondary schools have looked at schedules where one half of the children are in the morning and the other half are in the afternoon, and so they'll be able to collect a lunch as they leave, and then the other group can have a lunch as they come in. So the idea is that it's like they're moving traffic. So they would be going home then, and if they choose to pick up from a fast food on their way home, that would be their personal choice.
Right, and I think that, am I right in saying that the primary children, I think legally they've got to have a hot meal, is that right? I think, was that not something?
No, there's no legal requirement for it. The legal requirement is that we make available a free school meal as part of their entitlement. So, I mean, remembering that free school meals, all primary 1 to primary 4 are entitled to free school meals. It doesn't have to be a hot meal, but it should be. Right. You know, it should be a good quality, nutritious meal, but there's no legal stipulation on it. It does have to meet the Health Nutrition Act, so it does have to be a healthy meal.
It's a good job they didn't have that act when I was at school dinners years ago. I don't think that would have happened back in the day. I think the just what you've seen previously, that a hot meal sometimes can be the only decent meal some children get, and you don't want the kind of floppy sandwiches. Then obviously I see where you're coming from. You know, it would be far better if they did get that. And I see also that the government, both UK and Scotland, have now, thankfully, they're doing it over the holidays as well, because I think there's like kind of cash for kids and people that were doing that before the holiday hunger thing, which is huge in Glasgow, huge.
Absolutely. We're not providing a meal, we're providing a cash payment to families in lieu of a free school meal, and we've decided to add it on to their school clothing grant. So instead of getting £110 for their school clothing grant, they will get £190, right. And that's in lieu of free school meals. We still have our holiday food programme throughout the summer, and even with this year's restrictions, we've still got some of those third sector organisations providing activities safely for the children, as well as providing them with a nutritious meal. And in other cases, they will deliver food to families.
Fantastic. And I presume at the start there'll be no breakfast and after school clubs. When do you think clubs like that will come back? Is that again?
We are still intending to have a breakfast club.
Good.
In our schools. Our working parents, many of our working parents rely on having that facility. And for some of our children, you know, they're leaving the house without getting something to eat. And so coming into school and getting access to food, to nutritious food, is a real help. So what we might have to do is restrict the numbers. Again, that's another kind of job for the summer, to look at how we would manage that.
Yep. And again, if you get down to 1 metre, it might make it slightly easier if that happens. So
yeah, it might make it slightly easier. It certainly make it slightly easier in terms of managing that breakfast club. I'm not convinced it's going to make it a huge amount easier for classrooms.
Okay, right. I presume primary and secondary with sibling children, I presume they'll be talking to each other where possible, trying to get them in the same days. Obviously, there may be a split afternoon and morning with Glasgow secondaries, the way you're talking there. But I presume siblings will be trying to be accommodated so that they're on in the same day and off in the same day.
Certainly, if they're in the same primary school, we would definitely be doing that. And where there was a nursery attached to the school, we would certainly be trying to do that. It is impossible to do it across primary and secondary. Right. It's absolutely impossible.
And I suppose the secondary schools, technically, they could look after themselves, right enough, isn't it? You know, they get to a certain age.
That is an assumption that the older pupils should be able to manage themselves. And I think we also have to remember that come August, then there'll be a range of other people who will be able to watch children, not just, you know, I think a lot of the difficulty we had at the outset of the lockdown was that, you know, your granny and your grandpa weren't allowed to. You weren't allowed to have a friend next door watch your kids. You absolutely had to stay firmly to your household. But those restrictions are starting to broaden out. And come August, I think that we'll have a broader range of people who can support children.
Good stuff. Right, some of the children who receive additional support learning, how is that going to still be accessed? They're still going to be able to get that? Obviously, in these unsettling times, a lot of the additional support needs of the children, it's probably quite critical that they kind of get that back again. Will that all be put back in place for them?
Well, remember that when we start our primary schools in August, under the current plans that we've got, is the children will be in very small teaching groups. So normally they would be in classes of up to 30. And now what we're seeing is they're actually between 10 and 12, maybe 13 children maximum in a class.
Mm-hmm.
So those small groups will allow much more individual attention from the teacher. So in those tiny groups, I think, children with additional support needs, their needs will be well met. And we've made those classes as small as we possibly can by using some of those specialist teachers to create the small groups. So I know, for example, that some schools have used their English as additional language teacher to create a small group of children where that is their additional support need. And she will work with them for the 3 days of school or the 2 full days of school. And for children who have, say, a need like dyslexia, then we've still got our dyslexia service providing advice and guidance. They won't provide direct support, but they'll provide support to the teachers. Of more of a challenge for us is the parents who have children who have complex range of needs, who they've maybe got medical needs or very complex learning difficulties. But our schools, again, our specialist schools will continue to teach them, continue to provide support. And they've already been working very closely with the families to look at the range of learning that can be provided for them in different ways, keeping bubbles. Because for many of those young people, developmentally, they cannot keep a safe distance from the adults. They're just not able to. And so, but as I say, our schools have very, very good relationships with their parents, and they're working with them to develop these bespoke packages of support.
So again, that'll be kind of as required in schools, as required. It will just be, if it's needed, it'll be addressed at the time.
Yeah, absolutely. And there's also, we're also been looking at our hospital education service, because the teachers who are based in QUEH aren't able to provide the support because of the clinical risk of infection. So there's been some support out at Sky House, where we have teenagers, older children out there, but we will need to go back to the clinicians as we get towards August to talk to them about how we manage infection control and how we can start to deliver a hospital service again, because education is just as important as their clinical care in terms of children's well-being and being happy. Then they will get better sooner if they are happier.
Definitely. I was talking to some of the kids. I'm back doing shows on a Thursday night in the hospital, and I was talking to some of the kids on the phone that were phoning down for requests and things. They are missing the school. They are
Absolutely.
First 2-3 weeks it was a laugh, it was a carry on, because they didn't. There are things that they didn't get finished in time. They weren't worrying about it, but they are definitely. They're a good bunch. It's normality. They just crave normality again.
Children need routine and structure, and they do enjoy learning. So you're right. The first couple of weeks is a bit of a laugh.
Yeah, it was.
But now it's not funny anymore.
Definitely. Right, we obviously touched on the shielding thing as well. There was a letter sent out, and people with household members are at high risk. Teachers, family members, children with family members, children. Again, you recommend that these children should be learning from home and not possibly entering the school environment at this time.
I think that we've got to go on the clinical guidance that's available at that time. And at the moment, they're saying we have to be very cautious with children who are living with relatives, grannies, mums, dads who have chronic conditions, and they should go to their consultant and really take advice from there. I mean, it may be that some older children can come to school and they just ensure that they are quite strict about the physical distancing to kind of minimize the risk. I think it has to be done on a case-by-case basis. Yeah. But in those cases, we want our schools to be very supportive of the families so that the children don't lose out on their learning.
Definitely. Right, the expectations of the pupils and parents for the homeschooling, for the homeschooling days, the actual children that are homeschooling all the time due to shielding, and the children that are homeschooling in the 2 days or 5 afternoons or mornings when they're not there. Is there any help available for parents that are possibly struggling with this? Because I've had a couple of parents on that have actually learning difficulties themselves, and they're finding it very, very hard to take on the role of of teaching them. So I'm just thinking scenario, you've possibly got a child that's got to homeschool for the 5 days, and you've got maybe a parent that's got learning difficulties. Will there be support packages put in place for them to help and assist them?
Yeah. So I said from the outset that we were not expecting parents to be teachers when we went into lockdown. We wanted them to support their child's learning, but there was no expectation whatsoever that they were able or could replicate school. We didn't want to put that level of stress on them. And we know that some parents, through no fault of their own, are not able to provide the level of support that perhaps other parents can. Mm-hmm. And so we have tried to compensate, but I would be kidding myself on and kidding families on if I said that we'd overcome that, because we absolutely haven't done that. I mean, the children have not been in school for 14 weeks. It's an unbelievable length of time. And then we've got our, the school holidays coming up, but it will be different from August. So if we're still on part-time education, the critical difference is that children will be in school for part of the week. So every week, the children will see their teacher will be setting work for them, they'll then be seeing them the next week and checking up on how much of that work has been done. So it will be a better offer and there will be less reliance. And if you like, the parents will be more of a supervisory role just to make sure that it's done. Where it's a child that cannot come to school across the 5 days, we need to look very carefully at the support that we provide and how long that we're able to sustain that position. I mean, if that was to go on for a really long time, it would be very damaging to children's education. If they can't engage with an adult, but we're looking at a better online learning. So better ways to maybe have little video clips of teachers that would be instructing a lesson, and then the child does some work. So we're already, I was talking today in the secondary school I was in, they're already doing, their maths department, recording loads of lessons that will be downloaded onto laptops to give to children so that they can start to have a much more kind of instructed route through their learning, and not as this 14 weeks where they've been very much left to their own devices.
So is there a consideration of a teacher online teaching, kind of live scenario? Is that, with Google Classrooms and Teams and all these kind of things to actually use that, maybe a group of 6 children at a time, that kind of thing?
There's potential for that, but you have to look at the number of resources that you might need for that, for the number of teachers. So the teachers, nearly all the teachers that we've got will be in schools teaching. There'll be a very small number shielding who may be able to provide some of that support, or you might have some capacity of a teacher in a school within their contractual time that they could do a little bit of online learning. But it would be wrong of me to promise that this was some kind of a magic offer that was able to come out. We just have to do our best, and we are learning, we're getting better at it. And we will be better prepared for digital learning should anything happen in the future, that's for sure.
Would you consider going into August, September time, when you work out your numbers of shielding children that can't actually come back and your amount of shielding teachers that can't come back either, possibly linking these ones together?
Absolutely. Without a shadow of a doubt, that's what we would want. At the moment, what I've done when parents have contacted me, I've said, contact your school. Contact your school in the first instance and have a conversation with them, and let's look at the support that's provided, because children want teachers they know. They don't want strangers appearing on a digital screen. This summer, I'm going to do some teaching, some maths teaching in one of our secondary schools as part of a summer program, and the other teachers in the department, the maths teachers, are going to do it online. And I've said to the head teacher, I'm not going to do mine online because your children don't know me. Mm-hmm. They need to get to know me first as a person, and you can really only do that in up close and personal in a classroom, appropriate social distancing rules. But I need to teach in a classroom with them. Their own teachers who know them, and they know them, can do it online. And I think that's true of the children at home. We do need to think of creative ways to support them, but also with people that they know and trust.
I think the fact that the head of education is going into a classroom's probably made them all jump online and keep out the road out your way.
Not at all.
That would be a next couple of days, wouldn't it? With the top one.
To do it all summer.
Yeah, terrible. These poor teachers are under some pressure there, I'll tell you. What about the children with additional needs for transport and things like that? Is the transport going to resume again for these kids? That kind of idea?
Transport is going to resume for all children, but we have to take the advice, which again is rapidly changing at that time. So if we took the situation as it is just now, my goodness, that's going to be a real challenge, isn't it? Because at the moment, what are they saying with buses? 20 to 30% capacity. I mean, there's not enough buses to be able to transport the children to school if they're working. We've got half the number of children going in, but the bus is only working at 20% capacity. That's awful. And then there's face coverings. So face coverings, being mandatory, but we don't want that to be a discipline issue. What if a child doesn't have a face covering? Face masks are all very well and they're all going to become the trendy thing, but you have to keep them clean. You have to wash them, or else they're carrying infection with them. So I think we just have to think through that very carefully, and we have to wait until we get the advice from government. And I've been talking to the specialist schools about the transport for the children with complex learning needs. They're talking about creating bubbles. So the same classroom, same class of children would travel on the same bus. So you're just keeping everybody together. So they're thinking of clever ways that we can minimize the risk of infection and keep the transport going and maximize the number of children that are going to be in that transport.
Yeah, another thing with the mask, I mean, you see people in the supermarkets wearing the masks just now. They tend to be touching their face all the time with masks as well, because it's always uncomfortable pulling at it and then they're touching. So they're actually, masks, I understand where it comes from, but people, mask discipline, I know the people in the hospital are horrified that the public all wear masks, horrified.
I know. I'm not a clinician, so you just go by the advice that's there. I'm not, the science behind it, I'm not overly convinced about it, but it can act as a barrier. My worry is that people and young people wearing them into schools believe they are protecting themselves. Yeah. And so they don't do the regular hand washing. It's like wearing gloves. Our health and safety team say don't wear gloves, because gloves lull you into a false sense of security. Yeah, definitely. Wash your hands. And today when I was speaking to the young people, they were talking about having hand sanitizer around the school. And I said, well, actually, I'm not a fan of hand sanitizer. It has to be alcohol-based, they've told us, before it makes a difference. Alcohol-based hand sanitizer is flammable. I don't want large quantities of a flammable liquid around our schools. And in any case, when you use hand sanitizer, again, it lulls you into a false sense of security that you're keeping yourself clean, when in actual fact, the schools tell us, the clinicians tell us that it's soap and water is what makes the difference, because that breaks down the virus much better. So we need to keep our children going with soap and water and make sure our soap dispensers are full. Much more important. Our children only get one chance at primary 4. They get one chance at primary 5, and we have to make it a good one for them. And we can't let this get in our way, because the quality of education is just far too important. Yeah. I mean, if I had my way and it was safe and we could get the scientific evidence, I would like nothing better than everybody back at school in August, because it is just so important for children to be learning.
Well, listen, you take it easy and try and catch a wee bit of break at the holidays.
Thank you very much. Well, thanks a lot. Hope it was okay for you.
No bother at all. Thanks again. You take care. Stay safe. Okay. Thank you. Bye-bye.